Great. So good evening, everyone. My name is Shannon. I'm a student recruitment representative with Fleming College. I am based at our Sutherland campus in Peterborough, and I've been with Fleming College for about 3 years now. I've been with the recruitment team for about 6 months, but prior to that, I also worked in a student-facing role with the School of Trades and Technology. So it's a pleasure to be here with all of you tonight, especially you, Madison and Carly. And just a reminder for everyone watching this, this session will be recorded and it will live permanently on the PSW program page for any future students who may be interested. So just a quick rundown of what this presentation tonight will cover and what it will look like. From approximately 6 to 6:45 will be our presentation, in which Carly and Madison will go into detail about the personal support worker program, what that details and what that includes. And then we will also follow that up with a short Q&A at the end. So just before we get into that, we are going to watch a short video here. Great, so that video just provides everyone with a high-level overview of what our 3 campuses look like, some of the highlights from each, and then some also really cool drone footage from up above. So before we get started on the largest portion of the presentation tonight, I do want to do a quick land acknowledgement. So Fleming College respectfully acknowledges that we are situated on Mississauga lands and the traditional territory covered by the Williams Treaty. Miigwech to the Mississauga people for allowing us to continue our work in your territory. So just a brief overview of tonight's agenda. Of course, we will be moving into introductions next, in which I will introduce you to my wonderful co-hosts tonight. There will be a discussion around the PSW program streams, so the different types, career pathways upon graduation, non-academic requirements that will be a part of the PSW program, clinical placements and prior learning assessments, and then at the very end, we will have a Q&A session. So who you're all here to see tonight and listen to are our wonderful coordinators of the PSW program, Carly and Madison. So Carly is a registered nurse with 12 years of nursing experience, focusing primarily in medical, surgical, maternal care, and most recently labor and delivery. She has been teaching at Fleming College for the past 5 years in both the personal support worker and practical nursing programs, where she supports students in both classrooms and clinical environments. She has also served as the PSW program coordinator for nearly 2 years. Carly is dedicated to fostering student success by helping learners build strong clinical skills, confidence, and a compassionate approach to patient care as they prepare for careers in the healthcare field. And we also have Madison. Madison is a registered nurse with 13 years of experience, primarily in the emergency department, with additional interests in women's health and geriatric care. She has been teaching at Fleming College for nearly 2 years in both the personal support worker and practical nursing programs. and has served as the PSW Clinical Coordinator since fall 2025. Madison is passionate about supporting students as they develop practical skills, build confidence, and prepare for meaningful, rewarding careers in healthcare. So, without further ado, I will pass things over to you, Carly.
Thank you, Shannon. So first, I just wanted to briefly outline what a PSW is. So a PSW is a personal support worker, a person who plays a vital role in healthcare. As a PSW, you will be providing hands-on care and building meaningful relationships with clients across a variety of settings. You will provide support physically and emotional care. PSWs work in long-term care homes, retirement homes, community and home care environments, and even hospitals as well. So why choose Fleming? At Fleming, we focus on preparing you for real-world experience. You won't just learn theory, you'll build on confidence through hands-on experience and clinical placements. Our program offers 400 hours of relevant theory and approximately 300 hours of real-life clinical training. The focus of this program is on lab components throughout both semesters, hands-on task-oriented skills and practice time, course content related to long-term care and to community care to diversify your experience, and innovative new lab facilities that simulate the work environment, and more theory related to practice. So at Fleming, we offer a few different program streams for the PSW program, giving you some flexibility in how and where you would learn. The first option is, you'll often see this in the OCAS when you go to apply, is PWS, which is delivered at our Sutherland campus in Peterborough. This is one of our main campus locations that offers a more traditional college experience with access to a wide range of student services and resources. The second option is PWF, which is delivered at our Frost campus in Lindsay, Ontario. This stream offers the same curriculum and outcomes, just different campus setting. So it really comes down to the location of where you live and the proximity of where you live and what works best for you and for your learning. The third option is the PWR, which is the PSW Living Classroom stream. This stream is delivered fully within a long-term care home in Peterborough. We currently have 2 homes that we deliver this through, offering a more immersive hands-on learning experience right from the start. All 3 streams lead to the same credential and career opportunities. It's really about choosing the learning environment and location that best fits your needs and preferences when you're looking to apply. So more about the living classroom we'll go into. So the living classroom is a truly innovative training model that prepares students by placing them directly within the long-term care home. What makes this approach unique is that learning happens right in the care environment, not just in the traditional classroom setting. From early in the program, students are immersed in real-world experiences, working alongside healthcare professionals and interacting with residents. Through this hands-on approach, students begin developing their skills in real time. They gain confidence as they practice what they are learning, while also building the compassion and communication skills that are essential in providing quality care. The living classroom also emphasizes mentorship and meaningful connections. Students are supported by experienced staff and have the opportunity to form relationships with residents right from the beginning of the program, which deepens their understanding of person-centered care. Overall, this model helps students graduate feeling prepared, confident, and ready to provide excellent care in long-term care settings. So within the living classroom, it's a unique and highly engaging way to experience the PSW program. You learn from inside a real long-term care home, hands-on experience early in the program, like I said, mentorship from healthcare professionals. Oftentimes the instructors that work in the living classroom at the nursing home actually work in that long-term care home as well. Mentorship from healthcare professionals outside of just that team as well. So you can often build more relationships with like dietary services, the nursing staff, even the nurse practitioners that work in the home. You can build those relationships early on, which helps you to build confidence, skills, and compassion. This provides you a strong preparation for the workforce because you're already immersed in it right from day one. Within this program, all of your clinical placements are delivered at the long-term care site that program is run through, which really makes you comfortable and has a high opportunity for you to have a career outside of the program. So when you think of any of the 3 program streams, they're all delivered in the same way. So the program is 2 semesters. It takes approximately 7 months. So if you were to register in the upcoming spring term, you would go you would have the spring term and fall term, so you'd be complete your PSW certification by December 2026. There's a mixture of lectures, labs, and seminars, and clinical placements within all 3 program streams. So on this slide, you can see the delivery of the 2 different semesters within the program. So first you have your semester 1, and then you have semester 2. In your first semester, you'll begin building a strong foundation of knowledge while developing practical hands-on skills right from the start. You'll gain real experience through our PSW Skills Lab, where you'll practice in a simulated care environment designed to build your confidence and prepare you for real-world situations. By the end of the semester, you'll take that learning into your first clinical placement in long-term care, where you'll apply your skills in a supportive supervised group setting. So your first clinical placement happens at the end of semester 1 in the last 7 weeks of the program. So you will already have developed some skills at the beginning of the term and then apply them in the clinical setting. In semester 2, you'll continue to grow your knowledge and step more confidently into your role as a future healthcare professional. You'll gain greater independence through a variety of clinical placements, including the community settings. You'll also take part in our professional practice and simulation course, which is designed to prepare you for the workforce. This includes hands-on simulation, real-world scenarios, resume building supported by our career services, and opportunities to connect with community partners, helping you feel confident, capable, and ready to begin your PSW career. And I'm going to hand it over to Madison here, and she's going to discuss what NARS are.
We are going to talk a little bit about NARS, which stands for non-academic requirements. These are an essential part of the PSW program. These are requirements that you must complete before attending your first clinical placement, and they're in place to ensure both your safety and the safety of the individuals you'll be caring for. These are not optional. These requirements are set by the School of Health and Community Services and our placement partners as a condition of students participating in placement. It is very important that NARS are completed by the specified deadline and that they remain valid throughout your entire placement experience. It is something that we wanted to touch on and talk about right from the beginning, because if students do not have NARS that are valid, they will not be able to attend placement in a timely manner, so will not be able to stay on track in the program. If you do decide to apply to the program and are admitted, you will receive a package with more information about NARS, but just some of the things that we wanted to highlight for you as being part of the non-academic requirements for the Personal Support Worker program are listed on this slide. So you need an immunization form signed by a healthcare provider, a vulnerable sector check within 6 months. This is one that we absolutely like to highlight because depending on where you live in the province, and you do need to apply using your home address, the wait can be quite long at times. So we like to highlight this right from the beginning so students can get a head start on this. As well, you need a standard first aid that is valid for 3 years, level C CPR, something that needs to be renewed annually, and a mask fit test that's renewed every 2 years as required. What is really great is that through the continuing education department here at Fleming, there are appointments available to students where you can get your mask fit testing as well as first aid and CPR. You can get these requirements done right on campus through Fleming. So it is always something that is an option for you. You can book through the college to get some of these requirements. An annual TB test is required, as are flu shots, depending on the type of year, 2 doses of a COVID vaccine, a WSIB student letter, as well as consent forms. And depending on if you are a domestic or international student, there are specific placement attestations and undertakings that are required to be signed. Okay, so placements. Now we're going to talk a little bit about the specific placements that you will be completing here at Fleming College. One of the biggest strengths of our program is the number of clinical hours. We have a large number of clinical hours compared to other programs, and you get to go out in semester 1 to clinical placement, which is somewhat of a unique feature of our program. So over the course of the program, you will complete 4 clinical placements totaling 300 hours. These will give you exposure to a variety of settings, including long-term care and/or retirement homes, as well as different community organizations and settings. So being able to begin placement in your first semester, you're applying your skills much earlier than in many other programs. As you progress, your placements do become more advanced and independent, helping you build both confidence and confidence step by step. Each placement's content and learning outcomes will build on the last, so you will need to successfully complete one placement before moving on to the next. This allows you to feel fully prepared at every stage of the placement process. By the time you graduate, you won't just feel ready, you'll already have that real experience working in your chosen field. So where will you gain this experience? Your first 2 placements will take place locally in Peterborough, Lindsay, and the surrounding areas. These first 2 placements are a group placement. So you would go out with a group of anywhere from 6 to 8 PSW students, and you will be paired with a site. And at that clinical site, there will be Fleming instructors on site to help you through your day-to-day tasks at placement. So because of that requirement to be in a group and to have Fleming instructors on site, those ones are delivered locally, generally Peterborough, Lindsay, and the surrounding areas, just depending on student preference, placement site availability, and other factors. Then, as you move into your community and consolidation placements, so these are in the second half of your second semester, students actually have a choice of placement location for these placements because they're based on what's called a preceptor model. So in these placements, you will submit your placement choices to our placements office. They work really hard to match students up with a placement site in their desired location. So where this really benefits students is that you are choosing to do your final consolidating placement in a location that works for you, whether that be, your hometown, somewhere that you're interested in living and working after graduation. It really allows students a lot of choice in helping to guide their future career path by working at a site and in a location that interests them. Okay, so postgraduate job opportunities. So students often ask, what happens after graduation? What are my options? Will I get a job? So our most recent study on this has shown that in 2025, PSW program graduates specifically had a 94% graduate employment rate in their chosen field. So the answer is that, graduating as a PSW, the outlook is very positive. There is a high demand for PSWs, and coming out of such a strong program, you are a very competitive applicant for employment. PSWs continue to be in high demand across Ontario, as well as within our Kawartha region. There are opportunities in places such as long-term care, retirement homes, home care organizations, and community agencies. So where you will really see advantage of this program is that a lot of our students don't even wait until they graduate to have job opportunities. So if students perform well in placement, have that positive relationship with their preceptors and the placement site, many of our placement sites do offer students interviews and employment while they are still in school. So when you complete this program, you're not just gaining a credential, you're stepping into a field with strong and immediate career opportunities. We also offer a number of job fairs throughout the year where you can make connections with local employers and really determine what is a good fit for you post-graduation. And I will hand this back to Carly now.
Yes, thank you, Madison. So lastly, we'll just talk about postgraduate options. So at Fleming College, we have a PSW to PN bridge program that runs for 2 semesters part-time. This is a great option for PSWs who are looking to extend their careers to becoming a registered practical nurse with Fleming College. So to be eligible for the bridge program, you must present an official transcript indicating that you are a graduate of the personal support worker program. After successfully completing the required part-time courses, PSWs will be eligible to enter into the next available second semester of our full-time practical nursing program. So if you take your personal support worker certificate and then these additional 2 part-time semesters, where it's actually only, I believe, 5 courses that you have to take in total, 5 or 6. So it's very part-time, and then you would go directly into semester 2 of the practical nursing program, not semester 1, semester 2. So the bridge program is a great option for anybody that's looking to extend their career into nursing.
Perfect. And so thank you very much, Carly, for that. Thank you, Madison, as well. Just a couple of things before we move into the Q&A section of the presentation. I did just want to post this screen here. If you're interested, you're more than welcome to scan the QR code and meet some of the students who have said yes to Fleming and learn a little bit more about why they have said yes to Fleming. So I know I always love meeting students and learning a little bit more about why Fleming was their first choice. So if you scan that QR code, it will bring you to our YouTube channel where there are a number of shorts available. And then lastly, I wanted to mention as well, a very exciting upcoming event we have is our open house on Saturday, April 11th from 10 a.m. until 1 p.m. That will be hosted at our Peterborough campus as well as our Lindsay and Haliburton campuses. So as PSW is offered at both our Peterborough and Lindsay campuses, we encourage anyone who might be interested to come out and check that out. It's a great opportunity to meet Carly, meet Madison, maybe meet some students who have taken the program, learn a little bit more about the Fleming community, and really see if you can see yourself learning at Fleming in the future. So just lastly, I did want to put our general email address here. So for anybody who has any questions about any of our programs, PSW, or any other programs that we do offer at Fleming, please feel free to reach out to us. Ask us at flemingcollege.ca is the general email. Or if you have more specific questions about the PSW program, you can reach out at pswcoordinator@flemingcollege.ca. Alternatively, feel free to scan that QR code and you can also book an advising session with a recruitment representative or officer. So without further ado, I will open things up to a little bit of Q&A. I think I do have a couple of questions actually to kick things off, if that's okay with the both of you.
Yeah, absolutely.
Perfect. So for starters, I know that this is a question from recruitment that we receive all the time actually, is what are the admission requirements to get into the PSW program?
So to get into the PSW program, you have to have successfully completed your high school diploma. If you did not successfully complete high school, you can still apply. You would just apply as a mature student, and then you would do a skills master trades test to determine your skills, and then you would be offered an admission package based on that average of your test.
Okay, perfect. And I know another question that we also receive a lot from students is, what does the day-to-day look like for a student, or what, maybe how is their week structured, especially for students who are coming directly from high school and they're used to that, specific classes at specific times, every single day looks the same. I guess what would a day in the life of a PSW student typically look like?
So typically it depends on our intake numbers of how our program's structured, but the general structure is you would have classes usually, and now this is for the regular stream program. So for regular stream program, so PWS or PWF, so at Sutherland or Frost, you would have classes in semester 1 for the first 7 weeks. You would have 1 class on Monday or Tuesday, and then you would have classes Wednesday, Thursday, and Friday, not all day, but typically you would have a couple hours of classes per day. And then in the back half of semester 1, it's more unique this way because we kind of run our semesters with front half and back half. which refers to the first 7 weeks of the semester or the last 7 weeks of the semester. So in the back half of semester 1, you don't have classes on Monday or Tuesday. That first class finishes, and then you go to your clinical placement on either Monday or Tuesday for the remaining 7 weeks of the program. And then when you look at semester 2, it's also run in front half and back half. So the first 7 weeks versus the last 7 weeks of the program. In the first 7 weeks, you would have another clinical placement starting in week 1 that runs either Monday or Tuesday. And then you would again have classes Wednesday, Thursday, or Friday, usually 2 of those 3 days. And then we don't typically do classes on weekends, although it's not unheard of. We have in the past, but typically we try not to. And then in the back half of semester 2, you would have, at that point, you only have one course that you come on campus for, which is either on Monday or Tuesday. And then you have your community and consolidation, where you're doing more clinical placement hours that you would complete Wednesday, Thursday, Friday, Saturday, Sunday, depending on the preceptor you're placed with, their schedule.
Okay, perfect. Thank you. That's lots of detail.
Yeah.
And I think actually, Madison, this might be a question for you. It's actually just one that I was curious as I was listening to this presentation. What are the types of simulations, or maybe Carly, this is for you as well. What are the types of simulations that you do run in that simulation lab? I think that was a course that students are required to take in their second semester.
Yeah, I can take this one because I actually teach that course most of the time. So we run a professional practice and simulation course in semester 2, which you would partake in simulations such as virtual dementia tour. You'll complete your GPA certification, and we also have a home lab simulation, and then we have a long-term care simulation that's delivered virtually online as well. Those are our current simulations developed, but we are currently also always developing simulations and adding them in. Right now, we're looking at adding in some simulations into semester 1 as well. So we would bring that in sooner into the program as well.
Okay, okay, so right away, which
Mhm.
I'm sure would be something maybe that would set the Fleming program apart from others, just in
Absolutely.
the applied learning element there.
Yeah. We have a newer, like, high fidelity simulation lab, so that we use that a lot in our practical nursing program, and we're trying to implement it into our PSW program more as well to utilize that because it's great learning.
Yeah, no, that sounds great. And I know another question we sometimes receive on campus tours is, especially when we're touring the space on campus, the home labs, we go by simulation labs. Students are always wondering what percentage of, I guess, exams or what portion of exams are typically practical hands-on exams versus, like a written test or something that's delivered online.
Yeah, so we have in our PSW skills lab in semester 1 or semester 2, you complete your skills practicing, and then at the end of that, you have a practical hands-on test for each of those courses. So one in first semester and one in second semester, where you have a practical hands-on test. You're one-on-one with a tester, they're marking your performance. It can be very nerve-wracking. And we understand that we're all great. Usually the testers are your instructors like myself or clinical technologists. So you are familiar with the people. So it makes it less nerve wracking. And then most of the other courses have testing components that will be sometimes online tests or in our testing center. We do a lot of case study assignments as well. We're trying to work more of those into the program as well because they're great learning opportunities as well to apply your knowledge versus just doing a simple multiple choice question test.
Right. Okay. And I guess that kind of leads into the next question about the delivery of the program being hybrid versus in person. I know you kind of addressed that there, but is there anything else you wanted to add to that?
Yeah, I would say we are a lot of in person, but we do have hybrid options. So some of the courses you'll find like two courses in semester 1 are offered online, and then 2 courses in semester 2 as well are offered online currently. We are looking into creating more high flex options as well to accommodate more part-time studies or even weekend delivery of the program too. But currently we don't have that available, but we are looking into those options.
Okay, great. And again, this is also a similar question we receive, just in terms of the delivery, part-time versus full-time. So I guess are there part-time options? I know you talked a little bit about it when it comes to the bridging between PSW
Mhm.
and practical nursing, but what about part-time options for students in PSW?
Yeah, so there definitely are part-time availability. if you wanted to be part-time, you would just work with myself as the program coordinator, and we could build you out a learning plan that helps you successfully meet the learning outcomes of each course, and what you're able to, the capacity you're able to take on. So we can break it down into 3 or 4 semesters if needed.
Okay, perfect. And then I guess maybe for this one is for Madison. How would that impact placement, or does it individually depend on the student's needs?
So once again, it will depend on the student needs and what kind of learning plan has been set out. What's really important with placement progression is that a student needs to pass the first clinical to move on to the second to move on to the third, and so on and so forth. So it does really depend, um, where we're fitting those clinical courses into their modified or part-time schedule. Oftentimes, what can be offered is the PILAR, the prior learning agreement. So if a student has, life experience as a healthcare aide or something in the healthcare field, they can actually submit a proposal to get credit for one of their clinical courses. So we do often see that with students who have worked in the field, maybe not as a PSW specifically, but if they can demonstrate that they have met learning outcomes, they can get credit for one of those clinical courses, so they won't have to include it as part of the program. The only course that is not eligible for that is our final clinical placement consolidation.
Okay. Okay, great. Thank you. And I guess maybe just one last final question too about placement is I know you had walked through all the different placement options or typically the locations in which students complete placements. Would you say though that long-term care is the primary placement location for students, or does that depend?
It depends. We have partnerships with a lot of facilities in the Peterborough area, but it varies semester to semester. So, for example, this semester we have some long-term care homes who aren't available to take students or have prior commitments, with other learning institutions. So it really does vary and flex semester by semester, but those group placements do occur in either a long-term care or a retirement facility. And I think there's
Perfect.
really great learning opportunities in both, because a lot of the retirement facilities, I think students are often apprehensive and feeling like they're not going to have as many learning opportunities if they're placed in a retirement home. But many of the retirement homes in the Peterborough area have what's called an enriched level of care. So the residents in those areas really do receive, that total care that you would expect to see in some of the higher care needs patients in a long-term care setting. So regardless of the setting, students are going to be provided with a lot of really excellent learning opportunities and the ability to practice those things that they have learned in lab and really put them into play in a real world setting.
Perfect. Thank you. And I think that exhausts my list of questions for now. Is there anything, Carly or Madison, that you wanted to add that maybe we didn't cover in the presentation, or any maybe even just a final piece of advice that you would give to students who are considering a profession as a PSW?
My advice would be to act sooner than later on your career advancement. I know personally for myself, I delayed going into school for a few years and I regret doing that personally. So I think if I could provide any guidance, it would be to do it as sooner than later if you can.
And I think I just, for healthcare in general, it's a really fantastic field of work. We want more of you to join us in this wonderful world of healthcare. There are so many opportunities, such a wide range of positions, regardless of your education level. There are so many different routes you can take, and it's just a really great field of work.
Okay, great. Thank you both so much for joining tonight. And at this point, this concludes our Wednesday webinar. So again, anyone who has questions, please feel free to reach out to either the General Ask Us email or the PSW coordinator.
That's great. Thank you.
Thank you.